How does cyclophosphamide chemotherapy increase bladder cancer risk? Imagine a powerful medicine used to fight cancer or autoimmune diseases. One such drug is cyclophosphamide. While it can be very effective, it also has some risks that need understanding. When cyclophosphamide is broken down in the body, it produces a harmful substance called acrolein. This compound is excreted in the urine and comes into direct contact with the lining of the bladder. The bladder lining, made of urothelial cells, can become irritated and inflamed because of acrolein. This irritation is known as hemorrhagic cystitis, which means bleeding and inflammation inside the bladder. Over time, this ongoing damage can lead to changes in the bladder cells. When cells are repeatedly injured, they may develop mutations, which are changes in their DNA. These mutations can sometimes cause the cells to grow uncontrollably, leading to bladder cancer. The risk of developing bladder cancer from cyclophosphamide depends on how much of the drug a person has taken over their treatment. The more doses they receive, especially over a long period, the higher the risk becomes. Research shows that patients who receive between 20 and 49 grams of cyclophosphamide have a moderate increase in bladder cancer risk. For those who receive more than 50 grams, the risk increases significantly. For example, after about 15 years, studies suggest that roughly 3 out of every 100 patients with moderate doses may develop bladder cancer, while about 7 out of 100 patients with higher doses could be affected. Bladder cancer related to cyclophosphamide usually appears many years after treatment, often between 10 and 15 years later. This long delay is because it takes time for the damage to accumulate and for cancer to develop. Before the cancer is diagnosed, patients might notice blood in their urine that isn't related to kidney problems or experience bladder inflammation. Persistent blood in the urine is a key warning sign that should prompt medical evaluation. The type of bladder cancer most commonly linked to cyclophosphamide is called transitional cell carcinoma. This type arises from the urothelial cells lining the bladder. While cyclophosphamide is an important treatment option, doctors carefully consider the dose and duration to minimize the risk of secondary cancers. They also recommend measures like drinking plenty of fluids to dilute the urine and using protective agents such as mesna, which binds to acrolein and reduces its harmful effects. In summary, cyclophosphamide increases bladder cancer risk mainly because its breakdown product, acrolein, damages the bladder lining over time. The risk depends heavily on the total dose and how long the treatment lasts. Long-term monitoring for bladder symptoms, especially blood in the urine, is essential for early detection. Always remember, if you or someone you know is undergoing treatment with cyclophosphamide, discussing potential risks and preventive strategies with a healthcare professional is the best way to stay informed and safe.